Welcome back to Medical Monday. I'm Carrie Sharp here with Dr. Jason Haslam, and we are talking about all things related to the hand, the wrist, the elbow, the shoulder, and really you cover the entire body, but that's what you specialize in as an orthopedic surgeon. If you have any questions for Dr. Haslam tonight, go ahead and give us a call. We have a couple of phone lines open. 615-737-PLUS is the number to call. Chad and Laura, I know you're on the line. We're going to get right to you, but I love show and tell, and you brought a few joints and different contraptions here. Show me what you have.
Well, in orthopedics, when the joints become so damaged, we end up just getting rid of the native joint. We do joint replacements, and many patients know about hips and knee joint replacements. And in the upper extremity, we also have joint replacements, which are made out of metal and plastic. And I brought a couple here. This one on my right here is the wrist joint. That's an artificial wrist joint. There's many patients that suffer from arthritis or have had post-traumatic arthritis, injured the joint. And when it's not salvageable, sometimes we'll use a joint replacement versus, for example, a fusion, which you lose motion. This is designed to maintain motion. We put those in patients fairly frequently for those particular problems. We also have this really small joint. It almost looks like a little tiny knee joint, and it's designed very similar to a little tiny knee joint. And we actually use that for the knuckles. These what are called the proximal interphalangeal joints. We'll oftentimes use it for these knuckle joints. And when they become very arthritic and patients are having trouble with it, we'll sometimes use that. We use those to preserve motion. We used to use a lot of fusions, and now these have become much more mainstream. They're much better materials, and I think they're a lot better for the patient.
If you have arthritis, when do you know doing a joint replacement is the right step? Because so many people have, you see their crippled hands, and when do you know it's right?
So that decision ultimately is up to the patient. So when patients keep coming back and they're having a lot of difficulty with a particular joint, and we've exhausted the conservative treatments, for example, perhaps injections or even bracing or physical therapy, if that stuff isn't working, then patients will sometimes opt to go with these types of options, which are small joint replacements. So ultimately, the patient decides, and I think they work very well for certain situations. They're not perfect, but it's a good option for many patients.
Is the recovery from joint replacement surgery a lot different these days than maybe it was 10 or 15 years ago?
Yeah, I think so. I mean, the reality is these particular joint replacements, the materials themselves have improved. The way that they're fixing in the bone is also improving. So a lot of times we can get patients moving a little faster. The technique is also important depending on what structures you cut to get into those joints. A lot of times we're using tissue sparing techniques to try to get into the joint, preserve some of the main ligaments and the main tendons so that we can start early range of motion activities right after joint replacement. It can be very helpful for patients.
I would imagine. All right, let's jump back to the phone lines. Chad is on the line. Chad, thank you for calling in tonight. What's your question?
Hey guys.
Hi.
I had a question about my fingers. I'm 26 and I wake up in the morning with my fingers extremely stiff sometimes. It's not really pain, it's just mobility issues. But as soon as I shower and the hot water hits my hands, it starts to feel better. From your show, it kind of sounds like I have carpal tunnel syndrome. This has been going on for like a month now, and I don't have health insurance. What do you think I should do? Any home remedies I can apply, or can I get a cortisone shot without a primary care physician?
Sure. Well, that's a good question. So it sounds like you're having some stiffness early in the morning time when you wake up, and that is a very common finding with carpal tunnel syndrome. So you're right. It's possible it could be something like that. But home remedies that might be helpful, we'd mentioned using a brace. Try wearing a brace at nighttime. You can even pick those up at the pharmacy, is what we talked about previously. And that might really help you. I would try that first. And anti-inflammatory may be helpful for you, Chad. And so taking, like, for example, Motrin or ibuprofen, it's an over-the-counter anti-inflammatory, can sometimes be helpful for you, for that stiffness that you might have in the morning time. So I'd certainly consider trying that. Sometimes it's none of those things, and we need to get an x-ray to kind of get a better understanding about what the joint looks like. There are other diseases, for example, rheumatoid arthritis can sometimes cause that type of a stiffness, but x-rays sometimes can be helpful in diagnosing that. So several things it could be, but those are some of the more common ones.
But maybe start with the ibuprofen and then the brace and see where it goes.
Yeah.
Okay, Chad, thank you for calling. Thank you for your patience tonight. Let's see, Laura has been hanging on. Laura, thank you for your call and question. What is it?
Hi, thanks. I actually have this pain at the of my thumb, kind of close to my wrist. If I put pressure on it, doing anything, it's really extremely painful. When I'm doing things like push-ups or opening jars, things like that, it really hurts. And it seems to me like it swells up sometimes, and I'm not sure, what that could be.
Yeah. So, Laura, pain around the base of the thumb is a very common complaint with patients that come in with arthritis around that area. It could be something like that. It could also be other things close to that area, including where a tendon runs over the base of the thumb. It could be something similar to that. But arthritis of the thumb is very common. It's the most common arthritis condition around the hand and wrist is right there at the base of the thumb.
Why is that? Why so common?
Well, this thumb of yours is, we're different than you've heard that, where we're different from apes. It's because we have this opposable thumb.
Right.
And at the base of the thumb, it has what we call a saddle joint, which allows the thumb to cross over and oppose. It makes us completely different than other animals in the animal kingdom. And I'm not trying to get off on a large tangent here, but what happens is that predisposes that particular joint to arthritis. And so it's a very common location to develop arthritis around the area of the hand and wrist. Overuse can sometimes cause that to be worse. Push-ups is a common finding where they put a lot of pressure on that particular joint. And it's a joint that we address as we get older. That joint tends to wear out quickly. And so it's something that, x-rays can give us more information about. Just a good physical examination in the office can sometimes pinpoint exactly where that problem is. So it may be something, Laura, worthwhile to come in and see us and maybe let us take a look at it.
Okay, Laura. And by the way, we are going to give that number at the end of the show here, so keep that pen and paper handy. We will give it out. I do assure you of that. Let's head to Nancy. Nancy, what's your question tonight?
Okay, thank you for taking my call.
You're welcome.
I have bursitis in my shoulder, which is so painful. I also have a tear in a ligament in my shoulder, very painful. I guess my question is, will the tear in the ligament, will that heal itself with the Celebrex or?
Yeah, it's a good question. So many patients have that same question of whether tears are going to get better. For example, a rotator cuff tear is going to get better in a shoulder. It sounds like you might have something similar to that particular problem. Those tears don't generally get better in terms of they reattach to the bone.
It's not going to heal.
It generally doesn't heal right away, but many patients can become asymptomatic.
Oh.
And the reason why that is sometimes giving it time, we'll have other parts of, for example, the rotator cuff take over, and many times patients will start feeling better. So giving it time, some physical therapy may be helpful. Anti-inflammatories may be helpful for it. So even though you may have a tear in a ligament, it doesn't necessarily doom you to having to have surgery or doom you to have a life of pain. Many times these things can get better.
She mentioned bursitis too. What is that?
So your shoulder has this, it's just this remarkable range of motion where you can actually windmill your arm around. You see pictures do that all the time. There's no other joints that have that capability. In order for a joint to do that, it has to have this interface between something that moves and doesn't move. There's an interface there which is called a bursa space, and allows that transition to happen between moving things and non-moving things. And when that interface, that little bit of tissue, becomes inflamed, we add a little itis on the end, and that's called a bursitis.
Gotcha.
That's where that term comes from. It's inflammation of that area of the shoulder. It's very common and can be extremely painful. So it's something that we see quite frequently.
And what do you tell your patients?
Well, similar to kind of what we talked about before, we try to avoid doing surgery on those. We try anti-inflammatory medications, physical therapy, heat and ice, give it some time. If it's not getting better with that, we'll oftentimes try to decrease the inflammation by using a cortisone injection. So those are very common to use. And last resort is sometimes we use surgery for that particular problem, but a lot of times we can get it better without having to do that.
That is good news. Let's hop to Renee. Renee's been patiently waiting. What's your question, Renee?
Well, thank you for answering my call.
You're welcome.
I have a problem with my left wrist. For no reason at all, it just started hurting yesterday, and it's extremely painful. I mean, whenever I try to move it to do anything, it hurts.
Well, something that comes on very acutely, I always get worried that it might be something like a tendonitis. Carpal tunnel syndrome is a little more insidious. It takes a little more time for that to happen, usually. But when someone comes to me and says, hey, this happened within 24 hours, I'm oftentimes thinking of, for example, a tendonitis around the wrist. So, but those are fairly easy to diagnose, and they're very pinpoint. So if you come into the office, we can sometimes pinpoint the location and find out exactly where the problem is very quickly. Sometimes it requires an x-ray, but a lot of times it's just a physical examination, finding out exactly where you're hurting.
The pain shoots all the way up my arm when it does that. And I mean, there is no swelling because I had the nurse at work look at it today.
Yes, yes.
She told me to just leave it alone for a couple of days, not to do anything with that hand, to see if it would fix itself, and if not, to go to the doctor.
Yeah, that's not bad advice. So resting the extremity will oftentimes make the inflammation go down. So that's very good advice. But when it starts to radiate, that usually is either the nerves which are irritated or even the tendons. Remember, these tendons are attached to muscles which go up into the arm, and so if there's an area where the tendon is irritated, very common to see it radiate proximal, kind of up to the arm.
What do you do for tendonitis?
Well, a lot of times we'll use the anti-inflammatories, as the nurse had mentioned before, just resting it can sometimes make it feel a lot better. Sometimes we'll use a brace to try to force the resting, and sometimes that'll make it feel a lot better. If worse comes to worse, we'll apply a much more aggressive anti-inflammatory, for example, a cortisone shot.
Right.
And physical therapy can sometimes be helpful in the right setting for this particular problem.
When people say, oh, I've got tennis elbow or golfer's elbow or whatever, is that tendonitis?
We don't really call those particular diseases tendonitis. A tendonitis refers to the fact that the tendon is actually inflamed. It's more of what there's a term called tendinosis, and that's a fancy term the pathologist has made for us. That it's really a degeneration of that particular tendon. It's an aging of the tendon, but it can be very, very painful. It is something that we do treat frequently. Sometimes we'll use injections around the elbow for that particular problem.
Okay, interesting. Yeah. Miguel is on the line. Miguel, go ahead with your question tonight.
Thank you for your time, doctor. My question pertains to, I do a lot of overhead lifting of weights and whatnot, and sometimes I get this popping, almost painful. It seems to be getting worse, mostly with overhead motions, and sometimes raising weights in front of me.
Yeah. So that sounds like it's around the shoulder then, is that correct?
Yeah, more towards the top of it, I would say.
Yeah. So there's a lot of things that can cause popping around the shoulder. Again, the shoulder is one of those amazing joints that has so much motion, and so then you have this structure that's moving a lot around structures that don't move. There is that interface that we talked about, what's called the bursal space, and sometimes you can get some thickening of that, and that's probably where a lot of that popping comes from. If it's not painful, I usually leave that popping alone. If it becomes an issue where it's painful, it usually means it's becoming inflamed. And in those situations, that's when we start treating it. And again, very common treatments are anti-inflammatories. Sometimes we do injections which are very powerful to decrease the inflammation around the shoulder. They're very targeted injections. We use ultrasound sometimes to get to the spot that we need to get to. But it's very possible you could have a bursitis. It could be an acute tendonitis, which we'd mentioned previously. Probably not a tear. If you're lifting weights, usually patients that have tears, they start to lose some strength in their arms. So it's probably related to some inflammation around that shoulder.
All right, Miguel, good luck. It brings me to a question of my own. You mentioned anti-inflammatory a lot, and obviously that's a great place to start. How long do you stay on those before you say, okay, this is not a lifelong remedy, I need to go to the next step?
Yeah, that's a good point. Those anti-inflammatories are not benign either, so they can have side effects associated with them, for example, ulcers and that sort of thing. So typically I'll have my patients take anti-inflammatories for a short period of time, and if they're not getting better, then we start looking at alternative treatments. Many patients can take those anti-inflammatories for years and not have problems. Sometimes we'll transition over to just a straight Tylenol. Sometimes that has a little less side effects that are harmful for patients. So there are some other options besides the anti-inflammatories. Okay, good deal. We're going to take a quick break. We do have a couple of phone lines open, so go ahead and give us a call with your question tonight. 615-737+ is the number to call. We're coming right back.